thank you for joining us today. I think Isaac is connecting to audio. Yeah. Okay. Thank you for joining us for our second session of our gender community of practice. As announced, we will take a closer look today at the Jessie Toolkit, Gender Equality and Social Inclusion Toolkit, which was developed by FET. And yeah, for this, I'm very pleased that we will be joined by Summer, Alex, and Jess from FET. And they are going to help us understand it a little bit better and yeah, walk us through it. So thank you very much for joining us today and doing this with us. And I'm very happy that we are able to record it as well for people to catch up later, and hopefully it will be useful for everyone. I will leave the floor to you in a moment. Just a heads up that the session will be slightly longer than announced. It will be 75 minutes so that we can cover everything. And I hope that will be possible for you to stay that long, but of course we understand if you have to leave early. All right, yeah, and as we said, there's going to be a recording. So if you're happy with that, and if not, if you prefer to turn off your camera, then that's totally fine. Okay, so I'll be handing over to Summer, I believe, and for you to introduce the team.
Thank you. Are you able to share the PowerPoint for us?
Sorry, obviously.
No, that's okay. But in the meantime, I'll just introduce myself. So I'm Summer. I'm the communications coordinator at FET, and I also co-chair FET's Gender Equality Working Group alongside Jess. And that's how we kind of become involved in the Jessie side of things within FET. I'll hand over to Jess and Alex just to introduce themselves quickly. I don't know who wants to go first.
I can go first. Yeah, hi everyone, it's really lovely to be here. So I'm programs coordinator at FET, and yeah, so like Summer said, working on a task force group, but also definitely still on this learning journey of Jessie. So it's great to kind of work through it with you as well. So thanks.
Yeah, so hello, I'm Alex, the Policy and Learning Officer at FET, and part of the Gender Equality Working Group. And similar to Jess, some of this is quite new to me, so like the various different bits. So I'm here to learn as well, which will be really nice.
Thank you both. And for the rest of you who have joined the call, it'd be great if you could let us know who you are in the chat, so just your name and which organisation you're joining from. And in the meantime, I'll just go through some sort of ground rules for today's session, which are on the next slide. So we're hoping that this will be a safe space where you all feel comfortable to share your ideas and your experiences. I was going to say stay muted, but there's so few of us on the call, I don't think that'll be much of a problem. If you have any questions, then please feel free to type them in the chat box, or you can raise your hand. And as we've already said, the session will be recorded, and we will circulate the recording as along with the PowerPoint slides, so you can revisit it and share with your colleagues. So we move on to the next slide. I'll just explain the aims of today's session. So we're hoping that we'll be able to provide you with some insights and some tools that will help you to think about Jessie throughout the project lifecycle. So when you're designing and evaluating your projects, feel more confident applying the Jessie approach to project design, implementation, and MEL. And in terms of the do section, we hope you're able to support your partners and your community to take a Jessie approach. So now we'd like to launch a quick poll. Not going to be very many responses, but that's absolutely fine. We just kind of want to get a sense of how confident you currently feel applying a Jessie approach to your work. So I'll just give you a minute or two to respond to that. And we'll be running this poll again at the end to see if there's any changes in how you feel. Yes, I can see we've had one vote so far. Two votes. Okay, great. Is it possible to show the results, or can you all see them? Yeah, you can. Okay, so we have one vote for very confident and two votes for somewhat confident. So that's great. That's really helpful for us to know. And seeing as we have sort of different varying levels of confidence, I think it's helpful for us all to get on the same page in terms of what we mean by applying a Jessie approach, and to introduce some tools that might help you to embed Jessie within your project. So I'll just hand over to Alex now, who'll explain what we mean by the Jessie approach and sort of give you an overview of our toolkit.
Thank you, Summer. Yeah, so I'm just going to talk a little bit very briefly about what is a Jessie approach and why it's important, and then introduce to everyone our Jessie toolkit. So a Jessie approach helps us to ensure that our work promotes gender equality and social inclusion. The framework within our Jessie toolkit, which, as I said, we'll talk about kind of throughout this presentation, helps us to both acknowledge and address situations or contexts where people are being either directly or indirectly disadvantaged or discriminated against. So using this approach is important both from a kind of selfish point of view, but also from a rights-based view. So for ourselves, we want our programmes to work and be as effective as possible. And that means reaching those who may, for whatever reason, have been traditionally excluded from accessing services or the outputs of our projects. So we know that such exclusion and inequalities are intrinsically tied to poor health, poor well-being and prosperity. So from a moral standpoint, we're compelled to act on this. And so not just because of the success of our programmatic activities. It's important to note that Jessie is not just gender equality, but also social inclusion. And a Jessie approach considers those unequal power relations and inequalities experienced by people as a result of their social identities. And I know that you're, the community of health, so you're gender equality rather. So I figure that you'll know, presumably, like quite a bit about this. So yes, those social identities include things like gender, but also someone's wealth, their education, their age, race, ethnicity, sexuality, and so on. And of course, we know that many of these social stratifiers can apply to an individual, and it's important to acknowledge and plan for that to make sure that our work is truly inclusive. Could I have the next slide, please? Cool, thank you. So our Jessie toolkit, which was developed in collaboration with the Liverpool School of Tropical Medicine, exists to try and support partnerships, whether in health or otherwise, to act on Jessie. So the toolkit helps us to identify areas within our own work that are opportunities to further promote inclusivity. So things like from the initial project design to the evaluation of activities. Could I have the next slide, please? Thank you. So why did we create this toolkit? So the toolkit is useful for us where we operate within funding models dependent on grants, where donors will be considering how projects will target progress on things like the SDGs, and how projects seek to address gender inequality. And funders like the FCDO will really want to see alignment with their call to action for gender equality, and specifically the strategic vision for gender equity. So this call looks at a number of different areas, but focuses on things like leave no girl or woman behind, with the idea that to create change, we should look at the areas where progress is slowest. But then also things like building an evidence base, which is disaggregated by those social stratifiers, which I mentioned earlier. So we know better who's left behind. And I think Jess will be covering a little bit on that later. And then things like challenging unequal power relations when we see them, and protecting and empowering girls in various different forms of crisis. And that protect and empower is a particularly strong driver within the FCDO at the moment. But we think it's not quite enough to just consider those aspects, but that our projects should be actively advancing and advocating for equal rights, opportunities, and respect for people of all genders and backgrounds. So the toolkit then helps to provide a framework for the design and delivery of effective and inclusive programmes, and walks us through the stages of a project cycle and how each of those stages can promote Jessie. So I think I'll hand over to Jess now, and they'll explain a little bit more about those steps.
Great, thanks, Alex. So yes, taking a Jessie approach. So as Alex has started to go into, unless vulnerable and or marginalized groups are explicitly targeted and engaged within a project, it's likely that they won't benefit from the specific work that you're trying to do and the project aims that you're working towards. So it's therefore important that Jessie is part of the project design. So for example, that Jessie is part of the rationale for a particular intervention to take place in tandem with the overall project aim. So for example, if yours is improving health outcomes, how do interventions within that project also focus on Jessie, so that it's then part of the project and then leading into the overall project aim. If you go to the next slide. So how does taking a Jessie approach actually work in practice? Like it's fine for us to say these things, but what does that actually look like? What type of activities can be integrated into your project design and project plan to ensure you are focusing on Jessie? So activities can include conducting a Jessie needs assessment of the context. So as part of a needs assessment that you're already doing, that's already taking place as part of your project design, you can include an additional focus on Jessie. So it doesn't have to be a separate thing. It doesn't have to be a separate activity. It could be part of the needs assessment that's already going to take place. Identifying relevant Jessie related activities and integrating these into the project. So this can just be identifying even just small activities that can be integrated into existing planned activities. So you might already know things that you definitely want to do as part of your project, but then it's like thinking through smaller activities that are focused on Jessie that can be included in those activities that you know you want to do. Establishing processes for identifying groups at risk of marginalized vulnerability and exclusion, so ensuring meaningful participation of key groups. So this might be prioritizing activities. So project teams should decide which of the Jessie challenges, which are identified in the needs assessment, are most urgently needing to be addressed, and then thinking about could feasibly and appropriately be strengthened. So how can the activities and processes you're already doing, how can these be strengthened so that they address the Jessie challenges that were found during the needs assessment? And then it's including those in your project plan. So making sure that they're in the project plan so you can kind of keep monitoring them and keeping an eye on them throughout the project. And then assessing activities against a responsive assessment scale. So Cymru will touch upon this a bit more, but it's kind of using a scale to actually be able to assess how those activities are going. So on the next slide is one example. So I thought I'd go into two examples here. So one is conducting a Jessie needs assessment. So as I mentioned, this can be part of your wider needs assessment, but it's important that there's a clear focus on identifying barriers and challenges. So what type of activities would make it difficult for people to participate in, for example? So things you could consider are like the time of day the activity is held at, how long it requires participants to be involved, considerations for accessibility of the activity, say for example if they're held in person or even online, what kind of accessibility things you need to think about so that you can make sure it's inclusive to all the different communities and groups you're trying to access and engage with. Jessie needs assessment can be conducted using primary and or secondary data. So primary data can include data from key interviews. So for example, with policymakers or experts in the countries that you're working in, semi-structured interviews and focus groups, as well as surveys. So these can be qualitative or quantitative surveys. And then also using secondary data. So this might be kind of larger population-based surveys or demographic health surveys if you're thinking about focusing on health, and existing published research. So using both these kind of types of data, it provides a more in-depth and informed picture of the context that you're working in and the challenges that are taking place and what the situation is. And then that enables you to develop your project activities and the design, which are evidence-based. So you're making decisions based on the evidence that you've seen from this data, which is really important to make sure you're targeting the priority areas that are most important. So the next example is identifying and supporting Jessie champions. So Jessie champions are individuals who support and promote Jessie awareness and drive Jessie mainstreaming initiatives. So the project team could consider identifying at least one local Jessie champion as part of within the project implementation site and as part of the project. And it can also be a Jessie champion in the project team. So maybe the team that are actually kind of developing and facilitating the project. A Jessie champion can ensure that the Jessie approach that you're focusing on as part of your project stays as a key focus and a priority within the project. So you have these individuals that kind of really make sure that it stays a priority whilst you also consider the other elements of the project that are important to focus on. So specific kind of duties or responsibilities of champions could include encouraging senior management support through arranging Jessie briefings. So really trying to engage senior management, getting their support, informing them of why it's important. Involving senior management in Jessie protocol development. So yeah, thinking about how you can improve areas within the implementation site or the institutions you're working in, and developing strategic alliances with different groups. So this outside of the institution. So how can you build that support and those networks outside of the institution you're working in? It's also important to ensure Jessie champions. So if you take this approach to identify Jessie champions, that they're supported by the team. So this might be quite a new role for people. So it's really ensuring that the roles and responsibilities are clearly articulated. They feel supported by the project team. There's maybe mentoring opportunities. It has support from senior management, and there's resources and time available for them to engage in this role. So it's really making sure that the project team support that. Of course, there's lots of other examples, for example, of types of Jessie approach. So increasing women's representation within leadership and decision-making, but those are touched on more in the toolkit, so we won't go into those today, but we're having a look into other types of activities you can do as part of your approach. And then finally in this section, in terms of integrating Jessie activities, is the checklist tool. So you might have already seen this in the toolkit, but the checklist tool can be used by the project team to ensure all recommended actions and considerations are in place. So it's on page 32 of the toolkit. So this is just a little snippet of what it looks like on the slide here. And the checklist can be reviewed regularly and collaboratively. So as a team, going through the different areas of the checklist would be a good way to kind of keep an eye out on how activities are going and if any project activities have changed. And then in the far right column, you'll see there's an activity coded, which is the Jessie responsive assessment scale, which we'll go through next. But yeah, that's also a helpful thing to see how you're getting along on the scale as well in relation to the activities that you're doing. So this is just a checklist template, so you feel free to adapt it however works best for your project, but hopefully it can be kind of a good starting point for when you're designing your project and then also implementing it. Okay, great. I'll pass over to Summer.
Thank you, Jess. So on the next slide, you'll see the Jessie Responsiveness Assessment Scale, which is quite a mouthful. It's also on page 6 of the toolkit. And as Jess said, it can be used to measure the extent to which Jessie considerations have been incorporated into both projects and policies. So as you can see, there are 5 stages ranging from the least responsive, which we call Jessie Unequal, to the most responsive, which is Jessie Transformative. And then you'll see at the bottom, there's a blue triangle. And these are Jessie responsive programs, and they cut across Jessie specific and Jessie transformative. So these are kind of where you should be aiming for. And if we go on to the next slide, and we can have a look at what these might look like in practice. So sorry, there's quite a text heavy slide, but I'll try my best to talk you through it all. So if a project is Jessie unequal, it perpetuates gender inequality and other forms of inequality by reinforcing unbalanced norms, roles, and relations. So this can mean that certain groups are privileged over others. So you might be privileging men over women. And it can mean that one group enjoys more rights or opportunities than the other. So if we're thinking about an example project, this could be a project that takes advantage of existing power imbalances within the community when collecting feedback on service performance. So not all of the views of the community are heard, and the data that's collected indicate that the community needs are all being met and that the project's on track to meet its objectives. So as a result of that, the challenges preventing marginalised groups from accessing the services are overlooked and they're left further behind, but it looks like you've got a successful project. And compared to that, a Jessie blind project ignores inequality. So Jessie unequal perpetuates inequality and Jessie blind ignores it. And it also ignores norms, roles, and relations which affect the community. So it can ignore differences in opportunities to resource allocation and opportunities. And oftentimes it means projects are designed on the idea of being fair by treating everyone the same. So, for example, this could be a new outreach project and it's set up to address the nutritional needs of the community. However, the project fails to identify the different needs of people with disabilities. So important determinants that would likely improve the nutrition of the most vulnerable members of the community are not addressed. And then if we move up to the sort of middle section of the scale, we have Jessie sensitive. So this means that gender and other forms of inequality are considered as well as norms, roles, and relations. So the project demonstrates an awareness of Jessie, but it doesn't necessarily take any action to address inequalities. So for example, during a leadership training project, participant data is collected and disaggregated to find out the gender and the ethnicity of the trainees who have taken part so far. And this research shows that the cohort is made up of 65% men and say they're all the same ethnicity, but no changes are made to the activities based on this data. So we found out what the differences are, but we haven't decided to change what we're doing to make it more equal and more inclusive. And then Jessie specific, so one step up. These are projects which consider gender and other forms of inequality and takes norms, roles, and relations into account, and thinks and considers how these affect access to and control over resources. So the specific needs of different groups of people are considered. So this could be the different needs of men versus women. And the projects may intentionally target or benefit a specific group to achieve the policy or the programme goals. So that's different to Jessie unequal projects because it's seeking to address certain often overlooked needs. However, it doesn't, again, address the sort of causes of inequality. So it'll address what these inequalities present as, but it doesn't tackle the root causes. So apologies, these are all quite health-focused examples because we are from VET, but if we take a telemedicine programme, for example, so this programme is used to be launched to provide online consultations, and a female staff member is appointed as the project lead responsible for coordinating the training for a cohort of predominantly male doctors. However, the project doesn't attempt to change any of the underlying power structures that underpin gender inequality in the workplace. So again, it's more about how the inequality is presented rather than what the causes are. And then the final stage of the scale, this kind of golden standard, I guess, is Jessie transformative. So this is when we start to address the causes of inequality, and we start to transform norms, roles, and relations through the inclusion of strategies to foster progressive change in power relations. So it really does all come down to power relations and access to resources and opportunities. So if we think about a project that might seek to improve girls' access to education in rural areas, the project team holds community awareness raising sessions, and they hold these with gender-specific groups and mixed groups, and they foster dialogue to address the barriers that prevent girls from accessing education in the first place. So this also tends to be more sustainable because it's tackling the problems which lead to inequality in the longer term. So we at THET recommend health partnerships to aim at a minimum for a Jessie sensitive approach. We know that it's not realistic or possible for every project to be Jessie specific or Jessie transformative, but we do recommend aiming for Jessie sensitive at a minimum and then moving up the continuum where it's possible to do so. So we thought it might now be helpful for you to start thinking about where your project activities might sit on this scale. So it could be a project that you're currently implementing or one that you've previously worked on. And I know these examples are just kind of made up short summaries, and your projects will be far more complex and nuanced than this, but it can be helpful to start thinking about some of the activities that you're implementing and putting them on this scale. So as Jess said, if you've undertaken a needs assessment, did you identify the key issues related to Jessie? So that would be a Jessie sensitive activity. Or in terms of stakeholder engagement, did you ensure participation of women or vulnerable and marginalised groups in the project design stage? So their needs were taken into account. So that would be Jessie specific. It's just a small group of us, so feel free to unmute and share any reflections that you have, or post in the chat if there's anything that jumps out at you. If we don't want to do that just now, our contact details will be on the slide at the end if you wanted to talk about any of your activities in further detail. And I guess for the purposes of the recording, it's not that helpful because people watching and catching up can't feed in, but maybe I'll hand over to Jess to talk about the monitoring, evaluation and learning section, and then if people think of any activities they want to discuss, feel free to pop them in the chat.
Great, thank you, Summer. So moving on to measuring change. So as we've talked about all these different activities, so then it's thinking about measuring these activities. So as I'm sure a lot of you know, in terms of all the work that you do, how important it is to collect data, as this enables us to assess if the project has met its aims, if we're reaching the target populations, and if it has a sustainable impact. So for the project team or partnerships that are working together and the target communities, data collection is important because you can assess if you're on track to achieve your overall project aim. You can assess if what you're doing is contributing to long-term change. Are your activities reaching the target communities? Are there any challenges you need to address? You can reflect on the participation of project activities and scrutinize how the project or the organization is operating. So are things working well? Are the project activities being inclusive? You can provide information on how the project is affecting communities, and also supports sharing of findings and encouraging learning. So that might be, through journal articles or workshops, etc. But it's also important that if you're reporting to a donor, for example, if you're working with a grant, it enables the donor to see the progress of your program and how money is being spent and who is benefiting from the project activities and outputs. So for Jessie, all of those areas and those questions they remain relevant, but it also allows you to look into further information and find out further answers to questions. So it can raise awareness of inequalities that exist. So collecting and measuring data on activities allows you to see what's happening and raise that awareness. Allows you to have evidence that you can then advocate for change. You can demonstrate the project progress, impact and challenges like we just talked about, and ensure that no one is left behind and all relevant stakeholders and voices are being heard, and ensure the project does no harm and accounts for different needs. So ensuring you measure all your activities allows you to have the evidence to then you can assess these things, but also so that you can do further action. So for example, if it is advocating for change. So on the next slide, what kind of data could you collect to answer those type of questions? So for example, the question, so are there gender differences in access to treatment? So you might, for example, collect data, sex disaggregated data from health facility records. So yeah, looking at do men more than women access treatment? So what does that mean? How do you then, what kind of intervention can you put in place to look into that? And then, for example, why are there ethnic differences in access to treatment? So qualitative data from focus group discussions, for example, or individual interviews with people who are not accessing treatment. So really trying to understand through interview, through focus groups, why people are not accessing treatment. So those are kind of two examples that you can look into. In addition to ensuring that the data collected within your project is disaggregated, so monitoring, evaluation, and learning activities should include both quantitative and qualitative indicators. So this is crucial to ensure that the progress towards Jessie can be measured. So it's really to understand the whole picture. So quantitative data gives us the hard evidence on gender and social imbalances, but does not explain why those imbalances exist. So a lot of people really want to see kind of the figures, the numbers, all of that. So that quantitative data gives us that solid evidence that's there, but it doesn't explain why that's happening. So qualitative data can give us information about the broader context within which we're working and helps us to better understand that quantitative data, those numbers, such as behaviors, motivations, choices, all of that can be found in qualitative data. So that can be in interviews, for example. So if you're using interviews or questionnaires to gather data, the language should be adapted to the local context, and definitions should be provided for staff and health service users where required. So thinking that's in the health context. So making sure that the way that you're gathering data, those questionnaires, the types of methods are accessible in the local context in which you're gathering the data. So important to keep that in mind. In terms of types of indicators you use to measure Jessie activities, this is very dependent on the types of activities you're doing, and I'm sure you'll have ideas about this in relation to your project activities. But a few examples are, so things that you could look into and measure is the number and proportion of leadership positions within the team held by women. So that's something you could collect data on, collect numbers on. Number and proportion of people at risk of exclusion, reporting improved access to health services. So trying to understand the people at risk of exclusion, and number of community activities addressing stigma and discrimination. So all of those areas can be found out through quantitative and qualitative methods. And then you can see on the slide here the kind of the process of monitoring, evaluation, and learning in the project design. So this is in the toolkit, but you can see that it's an integral part of project design, also implementation and completion, and it is involved in all stages of the project cycle. So the toolkit goes into these stages a bit more, but you can see how at where you're starting your project, where you're reviewing the project, and where the project ends, the different phases of monitoring and evaluation can come into that. Okay, I will pass over to Summer for the next part. Thanks.
Thanks, Jess. So we've had some feedback about the toolkit, and we're very aware that given how sort of lengthy it is, it can be less accessible for people who are just starting out, figuring out equality principles, people who might have less experience in project design, or people operating in contexts where equality principles are not fully supported, and also people who have barriers with accessing tools in their current format. Long PDFs are not necessarily the most accessible way to engage with these types of tools. So recognising this, this year we will be launching Made for Change, which is an interactive learning platform which contains various courses, including one that we've called Applying Gender Equality and Social Inclusion in Global Health. So it's strongly based on the Jessie Toolkit, but it's been modified, simplified and made more engaging. And it sort of displays key messages alongside graphics and illustrations like the ones on the slide now, to enable interactive learning. So the information is more sort of user-friendly, and we're hoping that it will help to increase awareness with a wider range of communities and in different sectors, and create an environment in which progress can be made towards Jessie. So like our toolkit, it is targeted at health professionals, but I think it's of value to anyone looking to strengthen their programs or just to learn more about equality principles. So the platform is due to go live very soon, and I'll share a link with Beth and the team so they can circulate it once it is live. But I can share my screen. If we stop sharing the PowerPoint, I can share my screen and just show you what it looks like and how it works. Share screen. Sorry, 1 second. In my window. Okay, are you all able to see this? Yep, okay, perfect. So when you open this site, this is what it looks like, and there's a description of the site itself. And on the homepage, there's different courses. So this is the one in question. And it would normally just say start here, but because I've been through it, it'll say restart. So you'll click on there, and at the top, you'll see that we have a sort of condensed version of the course available in Somali, Amharic, and Burmese, and we're hoping to translate it into further languages as well. And on the homepage, there's a description of the aims of the course and what the learning objectives are. So you'll see it's quite similar to what we've covered today, but at the start, there's more of a focus on key concepts and terminology. So there's more of an introduction to the concepts that you're all very familiar with. So we're hoping that this is something that might be of use to people in your partnerships or in your community who this is more sort of new territory for them. So if you scroll down again, there's different chapters. So we have 7 chapters in total, starting with unpacking Jessie terms, and then it goes through kind of some of the similar concepts that we've covered today. So the Jessie responsiveness assessment scale and MEL. But if I go up to the top and show you the unpacking Jessie terms, so it starts off like this. Down the right hand side, it has the different sections of this chapter, and then at the end there's a quiz. So you open it up and there's the learning objective for this chapter. You click start. It starts with the first set of terms that we're going to look at. It has a description, it has an explanation of why they matter, accompanied by an illustration and a case study, and what we can do to address the problem, essentially. And then here, on these terms that have a plus sign, these are just terms that we think might need further explanation. So if you click on these, it links through to a full glossary. So there's a you can access that from the top as well at any time. And throughout the course, we have these top tips. So you can click on these and it has some additional insights just to make it as sort of engaging and fun to use as possible. And then again, we have graphics and infographics for people who prefer to learn more visually. So you'd work your way through all the different sections of each course. And then at the end, you come to a quiz. So I'll just fast forward to the quiz. So it's just a short quiz at the end of each chapter. It has 3 questions. And say you get the answer wrong, which is absolutely fine. So you click through here, then you would get the correct answer there. So it's always about learning. There's no, you wouldn't be penalized in any way, but it will track your progress through each chapter. And once you get to the end of the course, there will be a certificate of completion that can be downloaded. So it's something that you can return back to. You have to create an account. It'll be free to use, but it can track your progress, so you can return to it as and when you have time. So again, you would just work your way through the various chapters. It will show you how far you've progressed. And then at the very end, there is a slightly longer quiz, which will test your knowledge on all of the various chapters. So I think there's 8 questions in this one. And again, they're just true or false questions, but it just helps to ensure that you're retaining everything that you have gained. And then at the very end, there is a conclusion section, a resources section, and the glossary. So on the resources section, there's the Jessie toolkit that we've talked about today. We also have a gender equality specific toolkit that doesn't talk about social inclusion if that's more relevant to your projects. We have a report and another webinar and things like that. And these are all FET resources. And then we've linked to some external resources from the UN or the WHO Gender Equity Hub that we think are really useful and support the platform. So I'll just stop sharing my screen there. That was a sort of whistle-stop tour of the platform, but as I said, it will be going live really soon, and it's free to access. So you'll be able to share it with your partners in your community, and that was one of the objectives that Beth shared with us, is kind of supporting you to support others to implement a Jessie approach. So we're hoping that that's exactly what this will help you to be able to do. So I'll just, if we go on to the next slide, I will just recap on the aims of today's session. We've completed it much quicker than anticipated because there's less people joining in, but we hope you have gained some insights that will help you to think about Jessie throughout the project lifecycle when designing and evaluating projects, feel more confident applying a Jessie approach to project design and implementation, and be able to support your partners in the community to take a Jessie approach. So maybe we can just relaunch the poll and see if we've had any changes in confidence levels. Again, I'll just give you a minute or two to respond to the poll. And I think there's a second question as well around how useful you found the session, which would be great for us to know. Okay, so I think we can see the responses now. Looks like we have 2 confident and 1 very confident. So that is great news. That means two of you have moved up the confidence scale. That's really helpful for us to know. As Jess and Alex said, it's very much a learning journey for us. We did develop the toolkit in partnership with the Liverpool School of Tropical Medicine, and they're very much the experts in this field. So we're on a journey of learning about how we can apply this to FET's work and the work of our partners, and also our grant holders. So it's really helpful for us to know that this is a helpful way of relaying the tools that are in the toolkit. We do have a bit of time left if there are any questions. Feel free to unmute yourself or pop those in the chat. But just to say thank you so much. It's been great to be here with you all. I hope you've enjoyed the session, and I'll pass back to Beth unless there are any questions. Oh, is that a link to the toolkit, Isaac, or to the platform? But you can get a link to both, definitely. We'll send a follow-up email with all the links that you need and the PowerPoint and the recording and all of that. It's probably the easiest way to do it.
Yeah. Great, brilliant. Thank you, Jess, for sharing your contact details for anybody that wants to get in touch. Yeah, just to say thank you all for your time. And yeah, if anybody has any, so it's for the platform. Yeah, so we'll make sure in the follow-up email, Isaac, that once the platform's live, we'll be able to share the link to it. And then you can all go and have a look and play around with it. Were there any questions from anyone about anything that we've talked about today, about any of your projects and how this might be useful, or just any questions in general about the gender community of practice? Yeah, go ahead, Fiona. Oh, there we are.
Hello. More a comment than a question. As some of you might know, we're currently working with a women's group on a definitely female-oriented project, helping women to upscale their small businesses and give back from their profits to help other women get started in business. So it's obviously a very female-oriented project in the first place. And one thing that we're really pleased with is that women who have husbands who are within the group we're helping, husbands have all been very supportive. And one thing that we hope we wouldn't measure, because our measurements are more on how many people are supported, how many people are benefiting from the new businesses and scaling and so on. Having reflected as we were listening now, I was thinking one thing we could have done, and might be something for future projects, would be to look at how attitudes within the community change, because we were thinking these women would be role models for others, for girls that can see women can run their own businesses, can be successful and motivated to do that. And if I'd sort of had this a year ago, we might have thought about doing some sort of questionnaire within the community about male attitudes or anybody's attitudes to appropriate employment for women, etc., and measuring change. So it's certainly something that I would reflect on for the future.
Excellent. Yeah, that's really good to hear, and absolutely that would be a really good measurement to look at. And actually it's something that takes potentially a bit more time than some of the other activities, so yeah, it's something you could look at measuring in the future.
Yeah.
Brilliant.
Great.
Thank you very much.
Thank you.
Thank you for sharing.
Isaac, is there anything that you wanted to highlight, or any questions you had? Feel free to put it in the chat if that's easier. I know sometimes it's easier to contribute that way if the connection's not great. But otherwise, thank you very much for your time. Lena, did you want to do a quick...
Yeah, just a very quick wrap up. I think most has been said already, but yeah, also thank you very much again from my side, Summer, Jessica, and Alex for joining us today. That was yeah, we really appreciate it, and that was really useful, I think. And I'm sure people are able to find it useful through the recording as well. So Isaac is saying he's interested to find out more about the Jessie checklist, which was only covered briefly, I suppose, but yeah, I'm not sure there's more that you'd be able to expand on that.
Jess, that was your section, but I mean, we could provide more guidance in the follow-up email. We can go away and think about some additional guidance if that's helpful.
Yeah. And we could also offer some development support in terms of, taking that checklist as a template and maybe working with you, Isaac, and Janet, maybe to turn it into something that was specific to your work and your projects. If that was of use, we could certainly do that.
Yeah, I was going to say it might be worth kind of trying it out for your project and seeing how it works for you when you go try the checklist, in relation to your project. And then, if you have any specific questions, definitely feel free to email us, and we can, like you said, Beth, and help work through using the checklist. But it might be worth having a go in relation to your specific project activities first, and then see how that goes.
Great suggestion. Thank you, Jessica. Okay, right. So we're gonna, if there's no other questions, we're going to wrap it up. Thank you again. And as for the next steps, the next session is not planned yet. So we are still thinking about topics and resources we could talk about. But if you do have anything in mind, any idea, any suggestion, or a resource that you'd like to share or you would like to hear more about, then feel free to contact us. Obviously, we will email around again to collect ideas. Otherwise, yeah, also a reminder, there's a shared document that you can use to pop in any ideas. We'll put a reminder about that as well. Okay, and sorry, the next session will be probably at the 26th of April. So we feel that going forward, it's good to have a set day of the month. So it will be the last day of the last Tuesday of the month, if that works with everyone. But it's something to put out there at the next session, I suppose. Okay, sorry, this was for the group, but yeah, thanks again. Yeah, for joining us today, and yeah, I hope you have a good day.
Thanks for having us. It's
Thanks,
been great.
everyone.
Thanks, everyone.
Thank you.
Bye.
Bye.